Hey ladies, in this video we're going to learn about diaphragmatic breathing. Diaphragmatic breathing is something that should be done early on. It should be the number one thing that you should focus on before skipping any steps to go any further into the core program. Diaphragmatic breathing is very important because it is the first step into the core. Your diaphragm sits up here and it should move as we breathe, guys. It should help expand, create that intra-abdominal pressure to come out into that belly as you breathe in, and then it should also allow the pelvic floor, which would be this right here, to come down. As we breathe out or we exhale, all that air is going to come up and back out your mouth. So we breathe in, air should come down into the cavity, into the abdominal cavity, expanding out, pelvic floor should lengthen as you blow out. Pelvic floor should bounce back up. So it's like the pelvic floor should move like a little trampoline with the diaphragm, which is this diaphragm, pelvic floor. They should move together like this. Sometimes postpartum, especially if we're in pain due to a vaginal scar or vaginal tear or a cesarean scar, we may start to breathe more up here. Notice I'm using a lot of this muscle tissue here. Instead of actually causing that breath to come in here, change the tissue in the abdomen and change that pelvic floor. And that's where we want our focus. So postpartum, if you're holding your baby, when you're feeding your baby, guys, this is a perfect time to practice this. You can sit and you can breathe into your abdominal cavity, into that belly, into the ribs, letting the ribs come apart. As you exhale, coming closer together. But again, you're practicing that while holding baby, or if you're leaning back in a chair, you can really think about that breath coming down into either that cesarean scar or into the labial tissue of that or the pelvic floor to allow it to move. If you are able to, you can also lay down and do this. It works really well if we can lay on our back and let gravity pull our organs out of the way. So I'm going to show you that now. If we can do this a couple minutes at a time or even multiple times throughout the day, it really helps with tissue healing, whether we had a vaginal birth or a cesarean. So it's very important with either one. So if I had time to lay down, I can prop my legs up, bending my knees, and I can focus on breathing into my ribs. As I breathe in, my ribs are going to come apart. My hands will move apart like little bucket handles. So they went this way. As I blow out, my ribs are going to come closer together. So I'm going to breathe into my hands again. Now, if I had a cesarean scar, I could even put my hand on top of my C-section scar and breathe into my C-section scar. Now this goes hand in hand with any scar tissue mobility that we're doing with our C-section scar. Because if I'm even working my C-section scar, I would be working the top tissue, and then I can focus on breathing into my scar while I'm working that tissue, and it's going to get the scar tissue to lengthen from inside and on top, which is really beneficial. Now, vaginal birth, I can put my hand on top of the labial tissue and I can breathe into my labia or into my hand. And you're going to feel it move just very slightly into your hand on there, and you can focus on breathing down into that tissue and then back out. If you find yourself clenching your glutes in this position, you can put some pillows underneath your knees here and let your knees lay on top of some pillows or some yoga blocks or rolled up blankets. And you really want the legs to be completely relaxed. This is a great position to do this in. And again, allowing your abdomen to truly move with you as you breathe. I personally like to put on some meditation work. One of the things that I do love is the My Life app or the Calm app or the Headspace. Those are all really great at allowing you to take your mind off of everything else that's going on around you and you to really focus in on your tissue and how it's moving. So again, a couple minutes at a time, a few minutes a day would be beneficial. But myself, I remember doing this most often when I would feed my baby, because that was a gentle reminder of time that I would actually breathe into my tissue, because I was doing that multiple times a day. So it was just a little trigger for me to take time for myself. And especially if I was breastfeeding, it was just kind of that letdown phase that allowed me to do that. If I was bottle feeding, it was to kind of get the baby used to the nipple on the bottle. Really just breathe in it, let the baby feel your calmness, and then it allows your pelvic floor to completely relax and able to connect with your diaphragm. So that's a nice little tidbit that I share with my clients and patients, and it's a gentle reminder for them. So then they're doing it multiple times throughout the day to help with their healing. And so you can do that too.